Hi, I am Dr. Spurthy G Janney, Specialist in Obstetrics and Gynaecology, Manipal Hospital, Whitefield, also practicing in Manipal Clinic Brookefield. Fibroids are also known as leiomyoma or tumor-like growth in the uterine musculature. Usually it is seen in around 60 to 70% of the women in their reproductive age group, out of which only 10 to 20 tend to have symptoms. They are usually non-cancerous, very rarely can turn out into cancer. Fibroids are broadly classified as subserosal, intramural and submucosal lesions depending on the location of the fibroids in the uterus. Coming to the symptoms, most of the times fibroids are asymptomatic. If symptoms are persisting like heavy menstrual bleeding, severe pain during the periods, or just a lower pelvic pain or pressure with which the women can have increased frequency of micturition or constipation if the fibroids are pressing on to the intestines. They are usually diagnosed on a routine pelvic examination wherein if the size is huge can be felt during the clinical examination. We also take the help of imaging modalities like a pelvic ultrasound, at times an MRI, to differentiate a lesion of fibroid from another lesion called adenomyosis. Fibroids need to be treated only if they are symptomatic. Treatment modalities include medical management and surgical treatment. Medical management comprises of hormonal pills or injections which will shrink the fibroid in size and relieve the symptoms. Also, an intrauterine device called LNG-IUS, which is a hormone-containing device inserted inside the uterus, can shrink the fibroid in size. Surgical management includes removal of the fibroid alone, what we call myomectomy, which can be done either through a laparoscopy or an open method. In women who have completed their family, we can go ahead with the removal of uterus, what we call hysterectomy, again through laparoscopically or an open technique. Post-surgery, a woman may have to stay in the hospital for about 2 to 3 days and resume her routine activities in about 2 to 3 weeks. A recent management modality which is practiced nowadays is an uterine artery embolization, which is done by an interventional radiologist, where the doctor injects a material into the uterine artery to shrink the size of the fibroid. In Manipal, we have advanced technology and equipments to diagnose fibroids, experienced and highly skilled gynecologists and interventional radiologists. Also, the availability of minimal invasive techniques in Manipal. We have trained nursing staff to ensure a hassle-free treatment in Manipal. Thank you.